You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
And as I mentioned earlier, commonly patients have eyelid ptosis, which I correct that through an incision inside the lid, no cuts on the outside that you can see, unless I'm doing a blepharoplasty at the same time, meaning removing upper eyelid redundant skin at the same time. And when we complete the surgery, the patients go to the recovery room and then go to a home or hotel, depending on where they are from. We see them the next day. Usually they have a little bit of blurred vision for a period of time because of the medications in the eye, ointment in the eyes, meaning a day or two. And they may have some swelling, some bruising. And on the same day, we ask them to put some cold compresses. And again, the vision could be slightly blurred because of the ointments that we use during the surgery and right after finishing the surgery. And the next day, again, they may have some blurred vision, but we want the patients to be somewhat mobile right after the surgery. And the next day, stay out of the bed, walk around as much as they can. We advocate that actually, walking and moving the ankles and the legs just to minimize the clot formation in the legs. And again, within 2 or 3 days, the vision becomes clear. They can do the computer work, but socially they'll be to some degree limited because of the bruising, swelling. With tinted glasses, they can go out for a dinner in a couple of nights. Again, those of us who are experienced enough have done enough surgery. As soon as we start making incision, we know how much the patient is going to bruise or bleed. And we may give the patient specific medications that are called tranexamic acid or DDAVP, which enhance the clot formation and reduce the potential for bruising and swelling. We don't see patients with really puffed eyes, they're blocked, they can't see for a period of time anymore, or it will be extremely, extremely rare. But most patients get some bruising, some swelling that will go away in a fairly reasonable time. And for the upper eyelid, that would mean within a week or so, most patients actually can resume their social and professional activities. And for patients, no strenuous activities, meaning playing tennis, jogging, swimming, golf for 3 weeks after the surgery. Whether it's the upper eyelid or lower eyelid, that would be the case. The lower eyelid recovery is a little bit longer. It may take 10 days to 2 weeks. And some patients will have some swelling in the conjunctiva that we have remedies for it and we implement. And regardless, most patients look pretty presentable within, again, 10 days, 2 weeks, and they can resume the activities, except for strenuous activities. We tell the patients not to take any aspirin-type medications 3 weeks before and a week after the surgery to minimize the bruising and swelling that I referred to. And they can see that many of these patients are very happy, gratified, and look more energetic, looks less tired. As I said, if we do ptosis correction, they're going to have improvement in their vision. Infection, bleeding can happen again, extremely rare. We minimize those. But we also, as I said, are absolutely precise about this surgery because this is not a forgiving surgery. The patients who wear contact lenses, we advise them not to wear the contact lenses for a week. They can wear glasses. But after that, after the first week, they can gently place the contact lenses. Patients have dry eyes. They may have a little bit more dryness after the surgery, but that usually is temporary. There are techniques that actually can make the dryness worse. But again, those of us who are experienced, we do not use those techniques, or most of the time, actually, the techniques that we utilize may actually improve the disbursement of the tears, thus reduce the dryness to some degree. Complications of eyelid surgery include those that are going to be occurring during the operation, which is fortunate of potential loss of vision whenever we operate around the eyes. That is extremely, extremely rare. The patients can have excessive bruising, bleeding after the surgery. Again, we minimize that by making sure that the patient's blood pressure is controlled before the surgery and during the surgery, after the surgery. Within a week or so, infection can happen. Very rare in the eyelids after the eyelid surgery. Fillers in the lower eyelid can produce a good deal of improvement temporarily. But the things that can go wrong is obviously lumpiness, meaning irregularities. The filler can get into the vessels, can cause blindness, but fortunately, again, that's extremely, extremely rare. It can cause too much fullness, not needed amount of filling, and sometimes it does cause persistent swelling. But those are fortunately unlikely possibilities. On a long-term basis, the lid can get pulled down. If that occurs, it can be corrected. That usually means that either the skin was removed too much, or the patient formed a scar tissue in the eyelids, or one thing was missed, and that is the tone of the lower eyelid that I mentioned earlier. Sometimes in conjunction with our lower eyelid surgery, or often actually in conjunction with the lower eyelid surgery, we tighten the tendon that holds the lid up, supports the lower lid up, and it is connected to the bone. And it's like a sling going all across the lower lid and holding it up. And we tighten that if it is loose to minimize the potential for the eyelid being pulled down. There are patients who are prone to having that kind of condition, and we need to detect that. We need to be aware of it, and we minimize, again, deterioration of the lower eyelid tone after the surgery. Those are the things that the patients can experience. Nobody should wake up not being able to see. Again, the vision will be blurred. If there is a problem seeing, the doctor should be informed immediately. But fortunately, that is incredibly rare. And as I said, in the 44 years that I've been doing this surgery, I've never seen one. For a consultation about blepharoplasty, you can call my office, 440-461-7999. Again, 440-461-7999. Or go to our website, that is Dr. Bahman Guyuron, one word.com. And we'd be happy to offer in-person or virtual consultation. Overwhelming majority of my practice is from out of town, out of country patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.